I'm Monica Aerosmith, and I have the privilege of being the Mission Integration Executive for Adventist Health and Rideout. Homelessness is a growing problem. It is probably nearing what some would call an epidemic level. Here in Yuba and Sutter counties, we estimate well over 1,000 people on a daily basis are living in homeless situations. Many of them are in tents, in cars, and there's another certain amount that are actually very close to the end of all of their resources and are about to become homeless. And so what we mean by mission integration then is actually moving out into the community and assessing and assisting in people's health needs. This is Terry Howard, and she is our director of our case management services.
So Monica and I are both registered nurses, and as we started to talk about the program to our staff in the hospital, there's a tremendous amount of interest to come out to the street to serve the population living on the riverbeds who are homeless. The nurses we will actually send down here with backpacks with basic medical supplies. We hope to be able to bring into this population telehealth to start some triage from our emergency room team and then bring them to the emergency room when appropriate.
Through our case management services at the hospital, she and her team know firsthand some of the impact of people who are experiencing homelessness and the impact they have inside our hospital. Every day we get people who say, I want to go out, I want to help, I want to be there. One way that we are reaching out is to combine our concern for those people who are experiencing homelessness with our health expertise and also working to help coordinate their entry back into the community as best we can. We certainly have encountered people that we suspect might be using in our drugs, and that's a difficult situation because sometimes you're not really sure which came first. Drug use ramping up as people are so down in their lives of where they are, or did drug use precipitate their fall into homelessness? Either way, they are still our fellow human beings, and we are going to work as hard as we can to have an encounter with each one that comes to us to see if we can put them in a better place than before we met them.
Our mission is living God's love by inspiring health, wholeness, and hope. And one of the most dramatic ways that we do that is through our street nursing program. But what we've decided is that really inspiring health, wholeness, and hope is how we go out and connect with them. Connect with them as human beings, as children of God, and find ways to bring health care to them, but most of all, how we can bring hope for the future.
I'm James David. I'm a student nurse from Chico State. I'm studying to be a registered nurse, and I think it's great that we're included with the Rideout Street Nursing, so thank you.
My name is Cindy Cooper. I'm the clinical supervisor for the street nurse program. Every patient gets vital signs taken, a temperature taken. We look for anything that's suspicious. So that might be swelling, it might be a complaint of dental pain. So we hook them up with providers and they facilitate that communication between a physician and the client. One of the things that we instruct them on is to seek primary care. We make that happen so that they can have continuity of care, so that they can get their needs met. They can develop a relationship with a healthcare provider. They can get not just instant care, they get great care. These people haven't had that. They've been using our emergency room for their primary care for many years.
One of the things that we help Ernie with is ensure that he understands the risks associated with smoking and help him if he's willing to take that assistance. Right now, we're still working on that. So.
I'm probably going to still smoke.
My job is to educate you on the risks associated with it and support you in your decisions, good or bad.
To have Adventist Health provide us the tools and the equipment that we need to serve this community that are so underprivileged. I was an ER nurse for 12 years. I've been a nurse for 30 years. And I think this is one of my most rewarding jobs ever, is to have the honor to take care of these people and to help them on their journey.
My name is Ashton Phillips, and I am a patient care coordinator with the case management department at Adventist Health and Rideout. We have seen 1,100 individuals that come in and see us, and we have helped temporary house 17 people. 17 people we have gotten off the street through our connections with the different shelters here in the area.
Our clients come from many backgrounds. Maybe it was the house burning down, as we saw in our previous client, Ernie. His house burned down and he became homeless. He wasn't homeless before that. Today, we doctored a wound that he had, a simple dressing change. He has a wife that's quite ill. He has a son that needs assistance. So he's now living in what they call Hollywood and camping, roughing it. With his wife and 6 dogs currently, puppies available for anyone who's watching.